Hi, I'm Dr. Ken Feldman of Cannabis Sage. One of the most important and often overlooked topics involving therapeutic cannabis is the potential for interactions with medications. And for adults over 50, this becomes especially important because many people are taking multiple prescriptions at the same time. Cannabis contains active compounds, primarily THC and CBD. These compounds are processed in the body through some of the same liver enzyme systems that process many of your prescription medications. As a result, cannabis may sometimes increase or decrease how certain medications affect the body. In some cases, that could potentially increase side effects. In other situations, some people report beneficial effects such as improved comfort, sleep, or reduced anxiety. But individual responses can vary dramatically. One of the medication categories with some of the strongest evidence for concern involves blood thinners. Examples include warfarin, also known as Coumadin, as well as newer anticoagulants such as Eliquis, Xarelto, and Pradaxa. CBD in particular may affect liver enzymes involved in drug metabolism. In some people, this could potentially increase blood thinner levels and raise the risk of bleeding or bruising. Some case reports involving warfarin have shown significant changes in INR blood test levels after cannabis use. Another common category is blood pressure medication. Examples include lisinopril, losartan, amlodipine, metoprolol, and hydrochlorothiazide. Cannabis may sometimes lower blood pressure temporarily or cause dizziness, lightheadedness, or changes in heart rate. When combined with medications that already affect blood pressure, some people, especially older adults, may feel unsteady or fatigued. In certain individuals, that could potentially increase fall risk. Sleep medications and sedatives are another important category. Examples include Ambien, Lunesta, Trazodone, Xanax, Ativan, Valium, and some antihistamines used for sleep. Because cannabis can also produce drowsiness or sedation, combining these substances may amplify those effects. For some people, that might feel calming. For others, it could contribute to excessive sedation, confusion, impaired judgment, slower reaction time, or balance problems. Another common group involves cholesterol medications, especially statins such as atorvastatin, simvastatin, and rosuvastatin. The interaction evidence here is less clear and often less dramatic than with blood thinners. However, because some statins are also metabolized through liver enzyme pathways, there is theoretical potential for altered medication levels in some individuals. For men over 50, prostate medications are also important to consider. Examples include tamsulosin, known as Flomax, alfuzacin, Viagra, Cialis, and finasteride. Some prostate medications can already contribute to dizziness, blood pressure changes, or ejaculation-related side effects. Cannabis may potentially intensify dizziness or sedation in some individuals, especially when standing up quickly or combining multiple medications. And finally, one medication category that may deserve even more attention than cholesterol drugs is antidepressants and anxiety medications. Examples include Zoloft, Lexapro, Prozac, Cymbalta, and Wellbutrin. Some people report that cannabis helps them relax or improves mood. Others may experience increased anxiety, racing thoughts, impaired concentration, or emotionally numb. Because brain chemistry, dosage, THC potency, and mental health history all vary from person to person, effects can be unpredictable. The same combination that feels manageable to one person may feel overwhelming or unsafe to another. Age, dosage, liver function, hydration, sleep, alcohol use, existing medical conditions, product type, and overall medication burden can all influence the outcome. And remember, cannabis products themselves vary widely in potency, formulation, THC concentration, CBD concentration, and quality control. This video is intended for educational and informational purposes only. It is not medical advice, medication guidance, or a recommendation to use cannabis. Individual effects and risks can vary significantly depending on personal health conditions, medications, dosage, product type, and other lifestyle factors. Before using cannabis or cannabinoid-based products, especially if you take prescription medications or have underlying health conditions, it is important to speak with a qualified healthcare provider who understands your individual medical situation. If you would like to learn more, visit cannabisage.com to explore additional educational information and take our free assessment, which provides a personalized informational summary. And remember, informed choices are better choices.